Hola, buenas tardes. Good afternoon. Wake up, everybody. Thank you again to Amex for allowing us to present our abstract on engaging youth in HIV, STD, STI prevention. As Daniel mentioned, I am here with an awesome team from Connecticut, and I'm going to take a few minutes just to introduce each one of them. The young lady here taking pictures, the paparazzi. This is Danielle Warren Diaz, and she's actually presenting with me today, but she's doing it virtually through the back. She is our program coordinator. Along with us is Mirna Milet Sayas, our medical case manager, Consuelo Munoz, another medical case manager, and the luckiest man in this room, and the newest member of our team, Angel Ruiz, who's also a medical case manager. These people are truly awesome. I am blessed to work with this team and be here with you to address some of the work that we do, share some of the work that we do in our world in Connecticut. And in recognition of World AIDS Day, I'd like to share with you a mural that was created by some of our kids in our program that were born with HIV virus. And since then, unfortunately, many of those young people have passed to the spirit world. So again, I'm going to ask us each to take a moment to reflect, dedicating this mural to the young people who live with HIV, those who have passed with HIV, including Andrew, Brian, and our champions that are living with HIV. And I also would like to dedicate it to each one of us who are in the trenches working day and night to make sure that we eradicate HIV and fight the stigma, particularly to my team. I have young people here that have been working in this program 22 years. These are the pillars of the program, which is Danielle and Myrna. So if we could each take a moment as you settle. And if you feel the need to share a name of someone that has passed, you feel their presence here today, please feel free to do so because I am going to do so. Vicky. Elizabeth. Benji. Joseph. Virginia. Justino. Stephanie. Thank you. Thank you for sharing. They're in our hearts, they're in our mind. And this presentation is dedicated to them. And the work that we've done is because of them. And the work that we're going to continue to do is because of them and the rest of us here. Our team, we work at the Connecticut Children's Medical Center. The Connecticut Children's Medical Center's vision is in making Connecticut's children the healthiest in the country. We're a little cocky sometimes, so. and along with that, we also have the blessing of working with the Office of Community Child Health, who has a pretty broad vision of community resource, a national leader in addressing critical health needs and challenges of children at the local, regional, state, and global levels. The Office of Community Child Health has a strong record of developing, supporting, and spreading innovative programs. And the approach that they use is through strengthening programs, through evaluation tools, access to resources, leveraging their synergies across programs, best practices, and promoting partnerships. And I must say that the reason that our whole team is here today in Atlanta for this week is because the Office of Community Child Health has sponsored us to be here to join you. So I'm going to talk to you a little bit about a beautiful initiative called the Hartford Youth HIV Identification and Linkage Consortia, whose mission is to prevent the transmission of HIV and sexually transmitted infections among youth through innovative outreach and preventive education, to enhance youth-focused HIV screenings in collaboration with community agencies, and of course to identify HIV positive, STI positive youth and link them into care, community resources, and most recently, link them into employment and career services, because we're also combating some of these health disparities and income inequities. So the history of HYHIL, as we call it, of this initiative started in 1999, when we saw the need in the community. Like someone mentioned earlier, people are not coming into the clinic, people are not coming into the hospital to get tested for HIV, much less the young folks. So we decided to figure out, okay, where are the young folks? Can we bring our services to them? And if we could do that, how can we do that? Well, there's too many, and there's too few of us, so we decided we needed to collaborate with other community-based agencies. And we started advocating. We started bringing our message across to different folks, bringing them to the table. And the goal our goal was always to improve health outcomes for youth affected with HIV. And in order to do this, it also provoked us to get out of AIDS in order to prevent AIDS. So we went and spoke to the churches, the faith-based community. We spoke to the schools. We spoke to other community health centers and community-based agencies. And we were able to secure some funding through our local foundation in Hartford to get us started. We were able to establish a part-time position for one person to help coordinate this initiative. And since then, we established the Hartford Youth HIV Identification and Linkage Consortia. Why? Why do this kind of work? Well, why continue doing this work? We started in 1999, and we suspect, CDC estimates 10 million new yearly STD infections among youth 13 to 24 years old. And we know that, having an STI or STD is a serial marker for future HIV infections, right? So in Connecticut, among youth in 2013, chlamydia, there was 68% among youth 15 to 24-year-olds, and gonorrhea, 49% among youth 10 to 24-year-olds. And syphilis, we're still seeing a lot of syphilis among youth, 20 to 24-year-olds, and that was at 30%. In Connecticut, in 2013, there were 10,637 current cases of HIV. And 33% of those were represented or are represented in the Black community, 32% in the Hispanic community, and 28% of new HIV cases in 2013 were among the 20 to 29-year-olds. And 6% of new HIV cases in 23 were under the ages of 20. Connecticut, unfortunately, ranks 7th in AIDS cases, and it costs $16 billion in healthcare costs to treat STDs and STIs. So the work that we're doing, Daniel earlier referred to, what it costs him on a daily basis, monthly basis, and annually basis to treat his HIV. If we invest more in prevention, perhaps we'll have less, and we don't have to worry about that kind of work. And so we're going to share with you what we do, all the work that we do with a little bit of seed fund. These are some of our partners that we work with in Connecticut. Some of them are in and out of the consortia, but there's a handful of us that work diligently and have been working diligently since 1999 to bring HIV/AIDS awareness, education, screenings, and linkage into the community. So we got savvy throughout different days of the year, say for National HIV Testing Day, Latino AIDS Awareness Day, Black AIDS Awareness Day, Women and Girls HIV/AIDS Awareness Day, et cetera, et cetera. We'll go out into the community with our partners. We'll set up an area. We'll offer HIV testing in the community. We'll do the rapid test. And we engage the young people. We engage them through music, either eating ice cream, or we'll have a bowling party, or we'll do something. Wherever they are, we'll go, set up shop, and offer them the HIV counseling and testing. And through this work, we've engaged many young folks as well for testing, as well as raised awareness. So we've gotten savvier, and we developed a health interactive project called the HIP Project, where we've established a relationship in partnership with the schools and the school-based health centers. And we do this targeted intervention in partnership with the theater production. A couple of actors that we know who are also educators. We go into the schools. So they have this production called the Stop AIDS Mobile Theater, and they do a 45-minute skit on risk behaviors. They're very quirky, they're funny, and they're engaging. The young people hear what they have to say, and they also contemplate, their risk behaviors and actually come up and get tested. We think that the kids don't want to get tested. We think that it's, there's a big stigma associated with it, but within their secure setting, they're okay. So far, we've been able to reach 40,000 students through this preventive education. We have administered about 3,000 HIV screenings, rapid tests, 3,200 STI, STD tests, and through some of these productions, We have found one HIV-positive young adult who was 19 years old, MSM, with a co-infection. He had HIV and syphilis. And had no clue. We were able to link him to a medical case manager, link him to ID care, and right now he's healthy. He's taking his medication and he's doing okay. Through another event that we did, a National HIV Testing Day, we tested another young man, MSM, and immediately linked him to care. Through these interventions in the schools, through the HIP project, we have found a 10% positivity rate for chlamydia. And we're seeing an increase of gonorrhea. Now, when we talk about advocacy, getting into the schools was no joke. As my husband would say with his Spanglish, no yoke. You know, you're not supposed to be talking about sex in school, right? You can't have condom distribution in schools, right? So we'll talk about that in a little bit. So this has been, 15 years in the making. So some of what we learned so far, the core elements of this collaboration, of this model, is definitely collaboration. You mentioned earlier, let's work together. We've always worked together. There's no way we could do this on our own. We engage other stakeholders, youth, community, and community-based agencies, leveraging resources. We didn't have an HIV counselor on our team. We had social workers, so we partnered with an agency that had a community-based, an HIV tester. So we would go out together and do this kind of work. Again, we're looking at a young person from a holistic approach, not just HIV. We do a lot of outreach. We outreach to our policymakers, outreach to the administrators in the school systems, outreach within the hospital setting. We're talking about, offering kids testing outside of the hospital. Are you kidding me? Yeah, we are. We raise awareness, and the goal is to prevent new transmissions. We talked about advocacy already. Early detection, somebody mentioned earlier, is very important to have improved health outcomes for youth. And this is an activity that we were sponsoring another agency who did an AIDS walk, and those are family, friends, and actually some of our clients as well. Another core element we found was linkage to care and community resources. So we go out, we engage the young person, we do the education, we offer the HIV counseling and testing. They accept, we test. So what happens? They are HIV positive, what do we do with them? We link them immediately to services. We have the medical case managers at every single one of our outreach events and every single one of our events to make sure that if there is a positive, this young person is linked. We're not leaving them alone for any moment. We also provide at our program intensive medical case management, mental health. And just recently, we secured another small grant so that we can hire a part-time outreach worker so that as we're engaging young people, regarding healthcare, we're also accessing them for employment services. We're finding a lot of young folks don't work. They want to work, and this is addressing some of these health disparities, income disparities. So we like to get them to link them into sources that can help them either write a resume, learn how to write a resume, and get part-time jobs or get full-time jobs. So this outreach person goes out with us now, and she's lovely. We've surpassed our goal 4 times over, engaging these young folks. And another core component is the structural component. You need a lead agency. This is a lot of work. We meet once a month at our facility, or sometimes we rotate to the different agencies. There's a constant communication going on, emails, phone calls. If you see us on our phones, Daniel, we were working. We weren't Facebooking at all. We were addressing some of the questions coming our way. So yeah, we definitely need a lead agency, a constant person or entity to take charge. And the Connecticut Children's Medical Center has been that constant entity taking charge. Blending of administrative resources. Here we are, again, getting out of AIDS to prevent AIDS. We did a health fair, and we brought our medical student out, and he was offering blood pressure screenings to the adults. It worked. We got a lot of people to the table. And collaboration is key. And these are our famous donkeys. The lady who started this program 26 years ago, Clara Acosta Glenn from Colombia, she was from the mountains of Monserrate in Colombia, and she brought her donkeys to Connecticut. And she says, competition is not going to get us anywhere. But if we cooperate, both of us will have success. And again, Helen Keller, alone, we can do so little. Together, we can do so much. And I think Daniel was talking about that earlier. In this picture here, this is one of our meetings, monthly meetings, and we have over 10, 12 agencies at the table strategizing, looking at how can we bring services to youth where they are. Again, pulling the resources. You know how much money is sitting around the table? None of it belongs to us, of course, right? But Working together is the key. So our goal is to diffuse this model and to share it with all of you. You know, we figure we've been doing this for over 15 years. We have some experience here. We can provide some technical assistance. Collaboration drives innovation. And the social impact, imagine, you know, looking at the vulnerable groups that we've been talking about since yesterday, all that we can do if we continue to pool our resources and come together. And Julie Schofield from the NASDAQ mentioned recently, coordinated efforts across public health and healthcare systems is beyond disease silos. We can't work alone. We need to do this together. And through our process of diffusion in our local area, we do it through the Ryan White Care Acts Parts A through D, and our planning consortiums, the various task force and groups that meet in Connecticut and symposiums. Because we have a fierce leader sitting back here, her HRSA project officer invited her and her team to the White House for National Women and Girls HIV Awareness Day. Again, we're advocating at every single level. It doesn't stop just with the schools or with the policymakers in Connecticut. Every person that we talk to, we're continuously advocating. And we're, you know, our international reach. We presented this model of collaboration way back in 2002 in Barcelona. We also presented at the Social Works Symposium Group in North Carolina recently this summer. And today we're here sharing with you some of the work that we've done and we want to do. Some of the challenges and successes, what we've learned, again, coordination is key. We need a lead agency. We're getting buy-in from stakeholders. It was very complicated for us to get condom demonstrations in the schools. We had to go to the board meetings. We had to write letters. We had to testify. We had to go to the PTOs. And we were able to do that. And then we were able to get the nurse practitioners and the nurses in the school-based health centers trained to do the HIV testing themselves. So this we've done with the group sitting around the table all the time. We had to come territorial issues. You know, Connecticut's very small, the smallest states, right? Everybody's turfy. Everybody don't step on my backyard. Well, we had to get over that, and we've learned to do that. We were ahead of our time. Now, most of us are familiar with the National HIV/AIDS strategy that President Obama executed in 2010 that talked about, you know, getting to zero new infections, talked about doing outreach, early detection, linkage to care. When that paper came out, we were like, whoa, that's our work. That's the kind of stuff we've been talking about for the past 12 years back then. Again, the new strategy has been updated most recently in July of this year, and it continues to talk about outreach, linkage to care, and looking at the health disparities and employment services. So we just got this little grant where we're going to get young people to be employed. So I think we're on the cusp of what's happening in the world, and we're going to continue to do so. Advocacy, sustainability, successes, pooling resources, effective advocacy. We reached over 40,000 youth with very, very little money. We like to share our best practices. And although we haven't done the research yet, we don't have an evidence-based approach, we do have an evidence-based informed approach to prevention. Again, getting out of AIDS to prevent AIDS. And basically, that's all I have to share, some of our resources. And thank you, gracias. You can follow us, and this is our website. And we forgot our numbers. Any thoughts, questions?